on behalf of the entire City of Providence and certainly the Substance Abuse Prevention Council, I'd like to thank Peter for hosting this and for his great partnership, and of course thank Dr. Gifford for not only being here but for his extraordinary leadership on this and so many other of our public health initiatives. You should all know that we're really being recognized around the country as a state that was a real model in the way that we vaccinated our community for the swine flu, and it has been recognized really around the country, and that's a real tribute to the leadership of Dr. Gifford, so I'm just applaud him. Similarly, the Department of Health under Dr. Gifford's leadership has also been a great partner as we're all working as a community to prevent our youth, or to protect our youth from smoking and to eliminate tobacco-related health disparities that Peter just mentioned. I particularly want to thank Caitlin Thomas-Henkel for her great work with the Mayor's Substance Abuse Prevention Council. I know many members are here today. Thank you for being here, but thank you, Caitlin, for your great work. And I'm delighted to be here to sort of kick off the tobacco prevention campaign. And as part of this campaign, we will begin a very aggressive outreach effort all across the city to really engage members of the community to join us as we reduce the influence of tobacco, and particularly big tobacco companies, on the health of our families, particularly our young people. And every community across Rhode Island will be asking their communities to do the same thing, with really the goal of protecting our children and all Rhode Islanders from falling victim to the really effective, incredibly well-financed schemes by the big tobacco companies to get our kids hooked on smoking. And that's what this campaign is about, to prevent that. And it will be a critical part of ensuring that our communities remain healthy and strong, and that we educate young people and families about the dangerous consequences of tobacco-related disease, and to really focus on some of the tactics that are used by the big tobacco companies, and some of which you'll learn about today. In addition to that, we will, in my administration, working in close partnership with the Substance Abuse Prevention Council, develop policies and explore some ordinances that will protect Providence youth in particular from the tobacco industry's marketing practices, and there's more on that to come. But I want to also acknowledge that one of the organizations, there have been many groups and individuals and advocacy organizations that have worked very hard to protect families in this city and our state from the harmful effects of tobacco. And one of those organizations that is with us today is the American Lung Association of Rhode Island. And today they are releasing their 2009 State of Tobacco Control Report, which tracks the progress on key tobacco control policies at the state and federal level, and assigns grades to tobacco control laws and regulations that have been enacted. And I really want to thank the American Lung Association for doing this report, and also to tell you what the survey shows. Rhode Island received 2 A's, which is great, in the areas of smoke-free air, thanks to our state smoking restrictions and for our cigarette tax. Our state also received a B for state secession coverage, thanks in part to a recently passed law which requires private insurers to provide coverage for all FDA-approved tobacco cessation treatments. So in those 2 areas, Rhode Island is doing very, very well. It's really important, however, that we continue to invest in prevention initiatives for our young people, and particularly vulnerable members of our community. And while we don't necessarily have the resources that the big tobacco companies have in the tens and hundreds of millions of dollars, we have something better than that. We have a community that cares about the health of the other members of our community and ourselves, and really a community that's committed to educating young people and families about the dangers of smoking and of tobacco-related diseases. Unfortunately, there's a real concentration of tobacco purchasing and tobacco vendors in some of our neighborhoods that have our low-income residents, and so that they become really fall prey to these incredibly attractive campaigns to get people to buy cigarettes, which are of course deadly. So we need to take this data, we need to take this GIS mapping and really build our campaign around this, so that we can ensure that we protect all the young people of this city and all the adults of this city from the dangers of smoking and tobacco-related diseases. So thank you all. I now have the great pleasure of introducing Dr. David Gifford, the Director of the Rhode Island Department of Health, who, as I said, is a great public health leader in our state and really nationally. So thank you, Dr. Gifford.